I was feeling everywhere but nowhere at the same time. Like I was at home with the kids, but thinking about my workload. And while I was at work, I was only thinking this work day is never gonna end. My name is Major Marie-Lou Bocage. I'm a nursing officer in the Canadian Armed Forces. During the pandemic, I was a flight commander of Canadian Forces Aero Medical Evacuation Flight in Trenton, in Ontario. And now I'm in charge of medical company at the 5 Field Ambulance in Valcartier. I've been in Canadian Armed Forces for 17 years. Nursing officer in Canadian Armed Forces are officers, and we're in charge of team of medical personnel such as other nursing officers and medical technicians. So right now I'm in charge of a team of approximately like between 80 and 100 medical technicians. In January 2020, my supervisor called me regarding Canadian citizens that were like stuck in China, in Wuhan, China, saying that there was a potential that the government would like CAF to be involved to bring them back, those people. I was really anxious when they started to think about sending us on this task. There were so many unknowns about like how long are we going to be gone? What if I get it? What if like my whole team get it? And then like it's a unique team in Canada. So if we're all sick, then there's nobody else that can do the task and bring back, because our initial mission at this unit is to bring back every CAF member injured or ill in the world, to bring them back to Canada or wherever they can receive the appropriate level of care. So if we're all sick or if we're all gone or in quarantine, well, that's a capability that the CAF will not have. And I didn't know at the time it was like only the beginning of something huge that went on for months and years. So that morning we left Hanoi, Vietnam, an hour and 30-minute flight to land in Wuhan. We knew we had 4 hours on the ground to test, like to take them temperature first and then board the passengers and leave. So when we landed, it was nighttime. Like we saw highways, but like no movement, no cars on the highway, only like lights. Then we landed in Wuhan. The passengers were stressed out, but we felt that they were really, really happy and appreciative to see us. It felt good that we had accomplished the mission. It was a super long day, but then we heard at that point, just once we arrived in Trenton, that there were other Canadian citizens stuck on cruise ships. So my team had to prepare equipment for the other team that would go out on the other cruises. But like I was quarantined, trying to talk to my people and task them on other. It was like no time to rest. It was just ongoing. I'm not a typical military person that we can imagine. But because I'm a nurse, I have this need of taking care of people and make sure that they're feeling well and that their needs are met. I feel like it's a bit of like on the other side of the spectrum of military, where we have to accomplish a mission and whatever it takes to accomplish it and to reach the objective is whatever it takes. So it's like, at each end of the spectrum, and I think I'm kind of often torn between those two objectives. My team, there was 6 of us, so 4 nurses and 2 doctors, medical officer. I feel like they really were super enthusiastic to get into that task, to be part of of the mission, to be in the action. So I had to show them that I have courage and that I'm doing it. I'm just not asking you to do it, but I'm also doing it. But in my heart, like I just wanted to be at home with my family, honestly. Mm. The greatest challenges during that time was, I believe, the balance between like my own needs, my family, and the balance between meeting the expectations of the CAF, of my chain of command. My immediate supervisor was located in Winnipeg, Manitoba, while I was working in Trenton, Ontario. And for him as well, there was big expectation. So he was really focused on the mission, while I was also focused on achieving the goals, like meeting the expectation, but also my people. So I felt like I was like a buffer between my team and expectations, like of the organization. I felt very alone during that time frame because the chain of command was so focused again on expectations, on meeting the mission, and I was really focused on my people. So I felt alone, like with that role of taking care of them. I reached out for support, for like mental health support. I had some meeting with a social worker, which really helped to be able to vent. I remember many times I just wanted to run, like I just wanted to go and leave. So meeting all those, like trying to meet all those expectations, trying to like to continue to be a mother and to take care of my kids, that was really challenging, finding the balance between that. And as a leader, I was also aware that my team, they were also feeling the same challenge, but who else would have done the work? So I had to be there for the team. So it was really helpful to have like a mental health support. It was hard. I was feeling like overwhelmed all the time. I was feeling that I was like everywhere but nowhere at the same time. Like I was at home with the kids, but thinking about my workload and what else I have to do at work. And while I was at work, I was only thinking, well, this work day is never going to end. I have so much things to do, but I really want to be home. When I reached out for help, I got the help that I needed. So I'm very appreciative of that. We're not discussing a lot about the stress or the impact it had on them, because I think I thought that they were like in it, like all in it. I think I was maybe like absorbing like the pressure from higher, uh, and then to protect them. But they were also, yes, very dedicated, and like they wanted to make things happen and to make things better. I talked with a few of them sometimes, like the ones that I was maybe a bit closer, about the like all the stress and all the anxiety, not the anxiety, about the high expectation of all the workload we had. And I think they knew that I was struggling a bit, but they were all super dedicated. And like a few weeks ago, I talked to one of them who was really helping me and helping like the team to go through all of this. And he was proud of what we accomplished, so it made me super proud as well of what we had accomplished. And most of the time I honestly was feeling that I wasn't maybe enough for them to lead them, but I was like really doing it because of my sense of duty, and because I wanted to be like good enough for them. But I spent the last 2 years like reflecting a lot about like those 3 years that I was in charge of that unit. And with a step back, I see more what I've accomplished, and I'm proud that that I went through it, and like with my family as well. Like I'm still with my husband, and the kids are healthy. They're doing well, so I'm proud of like of myself that I was able to to keep it together, and I'm very proud of my team as well, of everything that we have accomplished. I often felt like I wasn't the type of leadership that the CAF was looking for, because I'm a nurse, and I bring that color to my leadership style. And my leadership style, I think, is more towards like engagement of my team, and it works. So there was a period of time where I was doubting a lot about that, but I think now I know, like I doubt less, and I think my leadership style can make things happen.